फॉर लिवर. नेक्स्ट जॉन्डिस. ये चार्ट utmost important, utmost. Where is hemoglobin broken down? Spleen और RE cells. लिवर में भी होता है, lymph node में भी होता है. चॉइस आएगा तो हम कहाँ मैप करेंगे? हाँ डॉक्टर शिवानी, नहीं आएगा याद, नहीं आएगा. आई गो ओवर इट वंस, गो ओवर इट वंस. कुछ नहीं है, अनइम्पॉर्टेंट टॉपिक है, बट यू नेवर नो. तो एक बार जब हमारा सारा लिवर हो चुका है आज, एक बार इसको पढ़ लेना बस, कुछ नहीं है, डिवीजन है उसकी. फाइन, ओके. सी कुछ नहीं कहता है, वो कहता है सीरम एल्ब्यूमिन माइनस द एल्ब्यूमिन इन द साइटिक फ्लूइड. इफ इट इज मोर देन इक्वल टू 1%, इट इज ड्यू टू पोर्टल हाइपरटेंशन. और अगर वो लेस है तो वो टीबी की वजह से है. When it is due to portal hypertension, when the ascitic protein is less than 2.5 gram, तो वो cirrhosis की वजह से है. If it is more than heart failure, it is just telling you about the cause of the ascites. That's it. Go over it once, you will understand it. And ये learn ही करना है. Once everything else is done, just learn it. Okay? ये बहुत important है, इसको तो आपको अच्छे से कराया ही है, राइट. 1. Which cannot come in the urine? Unconjugated and conjugated. Why? Because unconjugated is with albumin and conjugated is just immediately converted to the urobilinogen and all that. Fine. So both of them do not come in the urine. राइट. सो बेटा ये जो चार्ट था इसको गो ओवर इट, ये बहुत इंपॉर्टेंट है. यूरोबिलिनोजन अंडरगोज एंटेरोहेपेटिक सर्कुलेशन, ये भी बहुत इंपॉर्टेंट है, राइट. प्लीज गो ओवर दिस चार्ट वंस एंड दिस इज योर मैजिक चार्ट विच यू शुड नो. बिलीरुबिन विल राइज in all the 3 jaundice, hemolytic, hepatocellular and obstructive, but the variety will be different. Unconjugated or indirect bilirubin is more in the hemolytic jaundice, whereas conjugated or direct rises in the obstructive jaundice. So obstructive में ALP high है and conjugative bilirubin is very very high. Okay. Next, urine. So please remember this chart and इधर क्या याद रखना है? Pale stools, dark urine, white clay stool, बेटा हमेशा obstructive और कुछ नहीं हो सकता. Fine. Whereas the stools in the hepatitis, stool in the hemolytic, normal to dark. Cool beta. So please remember, where do I see urobilinogen? I am not going to see urobilinogen in the urine when someone has obstructive jaundice. So ये जो magic chart है बेटे, go over it. ठीक है. I cannot emphasize less on this chart. ये आना ही चाहिए. Okay. Okay. Then these causes. Okay. Then these causes you must know बेटे. Causes में Gilbert syndrome recently पूछ लेते हैं. Gilbert syndrome is for direct hyperbilirubinemia or indirect. So Gilbert is due to the indirect hyperbilirubinemia or unconjugated. Right. Please remember this. Physiological jaundice, whenever the RBCs are breaking down, it is going to release more unconjugated bilirubin. Fine. Okay, very good. Then another one is Crigler-Najjar. So 2 syndromes which are associated with indirect hyperbilirubinemia, Gilbert and Crigler-Najjar. Whereas 2 syndromes which are associated with conjugated are Dubin-Johnson, Rotor. Now, once a question has come, how do you differentiate between Dubin-Johnson and Rotor syndrome? Then it is due to BSP test, bromosulfane test. That was the question. Dubin-Johnson में bromosulfane test comes out to be positive, Rotor में नहीं होता है. right? Bile duct atresia, bile duct obstruction, bile duct has not been formed, obstructive jaundice. Done bete. Now hepatitis. Hepatitis, ये chart, again a magic chart. I am not best beta, you are the best. ठीक है, चलो वायरल हेपेटाइटिस जल्दी से पढ़ते हैं. मैजिक चार्ट है, ये याद नहीं है तो करना पड़ेगा. ठीक है, ये याद कर लो. ओनली डीएनए वायरस इज हेपेटाइटिस बी. फाइन, इंक्यूबेशन पीरियड पे रीसेंट क्वेश्चन आया हुआ है, सो याद कर लो. ठीक है, हेपेटाइटिस बी 1 to 6 months. Transmission fecal-oral is for A and E. Rest are all percutaneous. Perinatal sexual. Fine. Perinatal is very important for hepatitis B. That means the mother to the child. Right? That transmission is very important in hepatitis B. Okay. Clinically, you must know the fulminant form is D form. है ना, मोस्ट फल्मिनेंट इज द डी फॉर्म, बट डी नेवर अकर्स अलोन, इट इज ऑलवेज विद बी. राइट, अगर प्रेग्नेंट फीमेल है, जो मोस्ट प्रोबेबल क्वेश्चन है, डी पे शायद नहीं आएगा, बट प्रेग्नेंट फीमेल अगर है, फल्मिनेंट हेपेटाइटिस इज हेपेटाइटिस ई. ठीक है, इसमें गलती नहीं करना. Chronicity, you know, BCD, C is maximum. Career, BC, C is maximum. Cancer, BC again, but B is maximum. Right? Prognosis, you know, for A and E, very, very good. D अगर B के साथ हो गया, very, very bad. Right? C अगर chronicity में चल गया, very, very bad. C cancer हो गया तो very bad. So इसमें क्या question आता है? Excellent prognosis is of what? A and E. Next, vaccine. Vaccine I have for everyone except C and E. उनका नहीं होता है. D का भी वैक्सीन होता है, which is same as your B vaccine. Fine. चल. Next, fecal-oral route done. Then perinatal done, parental transmission done, chronicity done, cancer done, vaccine done. ठीक है, done. Okay, which is ये वाला question कितनी बार हमने किया है ना? Most common hepatitis which is occurring with transfusion reaction is hepatitis B. Confuse नहीं होना. Many books write it as HCV, which was right answer. अब नहीं है. Okay, next, fulminancy we have done, pregnancy we have done. Okay. Next, hepatitis A, it is most common epidemic in children in India. It is self-limiting. Hepatitis C, it has maximum chronicity, maximum carrier. It is cancer causing, but maximum becomes the B. Right? Important feature, extra hepatic features दोनों में होते हैं. Hep B में भी, Hep C में भी. What are they? Agranulocytosis, non-Hodgkin's lymphoma, diabetes mellitus, Zika. But EMC, essential mixed cryoglobulinemia, is important for Hep C. Fine. Next, hepatitis D हमने कर लिया है. Okay, hepatitis E also we have done. It is the most common epidemic in adults, and अगर pregnancy में होता है, then fulminant. Fine, it occurs due to faulty water when in a village the whole well is infected. Fine, or undercooked meat. Needle stick injury में C more than B. ये कहाँ का डाटा है बेटा? I will confirm this. कितना मतलब क्या परसेंटेज है? I will confirm it. Okay. Hepatitis B. Hepatitis B. गलती कर ही नहीं सकते. फर्स्ट मार्कर HBs एंटीजन सबको आता है. राइट, HBC एंटीजन होता ही नहीं है, वो कोर में होता है. राइट, देन कम्स एंटी HBC एंटीबॉडी. IgM है तो अक्यूट, IgG है तो क्रोनिक. For infectivity, HBe antigen is there. High infectivity, HBe antigen is positive. Right? If low infectivity is there, anti-HBe antibody comes, right? Whereas anti-HBs antibody means antigen is gone, vaccinated human being or the person who had a disease got cured, got immune to it. ठीक है? So immunity, right? What is window period? Important question. Window period matlab where we don't see antigen, where we don't see antibody. Which one? HBs, surface wali, right? But only thing which I can see is my IgM. This particular chart pata hona chahiye bete. They will give you which one is red, which one is green, which one is blue, which one is the window period. So please note. Please note bete, this is very, very important, right? From 24 to the 30th weeks, we are having window period where I am not seeing anything but IgM. Fine? Okay. Now, this again a magic chart which I have taught you very well, right? Acute में क्या दिखेगा, high infectivity में क्या दिखेगा. बेटा अगर ये नहीं आता प्लीज इसे रिवाइज करो, प्लीज करो, अभी करो. ओके हाँ, ये तो है ना बेटा, वो क्वेश्चन रिलेटेड टू योर HIV एंड हेपेटाइटिस है. बट वाई नीडल स्टिक में C इज हैविंग मोर चांस, आई विल सी if any percentage difference is there. Dr. Dipesh, please give me some time, I'll confirm this. Okay, so this chart is very important, very, very, very. ये सारे important question है. First antigen, first serological marker, first antibody to appear, markers for replication again, quantitative DNA polymerase, दोनों DNA polymerase, HBV DNA. Qualitative is HBe antigen. HBV DNA is the gold standard, most specific, most sensitive, and it is quantitative. Fine? Okay, done. Okay, one more thing bete, HIV, rabies, Hep B, in तीनों की vaccination post prick I have done with you. ठीक है, ये हम माइक्रो में कर चुके हैं. रेबीज तो पोस्ट बाइट है, HIV पोस्ट प्रिक में कर चुकी हूँ, राइट, पोस्ट एक्सपोजर. हेपेटाइटिस बी ट्वाइस आई हैव डन विद यू ऑल. इफ यू हैव नॉट डन, थ्राइस रादर, TND में भी किया है. सो अगर ये नहीं किया है तो इसको लर्न करो. फाइन.